Hey everyone, this is Mami Dhaneshwari and today I am going to discuss the urinary system. So let's start with it. The urinary system is the main excretory system of the body which expel the waste and excess material from the body. The urinary system is also known as the excretory system or the renal system. Now we will see the functions of urinary system. So what are the functions of urinary system? Maintaining homeostasis of water and electrolyte concentration and excretion of metabolic waste material from in body in the form of urine, and excretion of nitrogenous compound urea and uric acid, and excretion of excess iron and some drugs, and maintain acid base balance. These are the functions of urinary system, and it also include production and secretion of the erythropoietin, and production and secretion of the renin. These are the various functions of urinary system. Now we will see the components of urinary system. So what are the components of urinary system? Two kidneys which secrete urine, two ureters which transport urine from the kidney to the urinary bladder, and the urinary bladder where urine collects and temporarily stored and the urethra, through which urine is the through from which the urine is discharged. So these are the components of urinary system. Now we will see the kidney. What is kidney? Now we will see the location of kidney. The kidney is lie in the posterior and abdominal wall on each side of the vertebral column and behind the peritoneum and below the diaphragm, and their right kidney is usually slightly lower than the left. Now the kidney is in bean shape and bean shaped organ, and that its length about is 11 centimeter, and its width about 6 centimeter, and 3 centimeter thick, and its weight about is 150 gram. These are about the kidney. Now we will see the gross structure of kidney. The longitudinal section of the kidney shows the three areas of tissue, that is a fibrous capsule, a cortex, and the medulla. A fibrous capsule is surrounding the kidney, and the second one is the cortex. The cortex is a reddish brown layer of tissue immediately below the capsule and outside the pyramids. And last one is the medulla. The medulla is the innermost layer and consisting of the pale conical shape striations and the renal pyramids. This is about the gross structure of the kidney. Now we will see the microscopic structure of the kidney. So nephron is the smallest functional structural unit of the kidney. The kidney is composed of about 1 million of functional units, that the nephrons, and the smaller number of collecting ducts transport time through the pyramids to the renal pelvis, and the tubules are surrounded by the small amount of the connective tissue and containing blood vessels and nerve and lymph nodes. This is the microscopic structure of the kidney. Now we will see the nephron. What is nephron? The nephron consists of the tubule closed at one end, and the other end opens in the collecting tubule, and the closed end is intended to form the cup-shaped glomerular capsule, is also known as a Bowman's capsule. And from the Bowman's capsule, the remainder of the nephron is about 3 cm in length and described in the three parts. And that is the proximal convoluted, it's also known as PCT, the medullary loop, that is the loop of Hinel, and last one is the distal convoluted tubule, which means DCT. This is about the nephron. Now we will see the process of urine formation. So the main function of kidney is the formation of urine, and it is divided into three processes, that is filtration, selective reabsorption, and the secretion. So now we will see the filtration. Filtration is assessed by the difference between the blood pressure in the glomerulus and the um, and the um, and the pressure of the filtrate in the glomerular capsule. The volume of the filtrate formed by both kidneys each minute is called as the glomerular filtration rate, GFR. And in healthy adult, this GFR rate is about 125 milliliter per minute, and is that 180 liter per day by both kidney in one day. This is about the filtration. The process of urine formation, and the second type is selective reabsorption, a movement of substances out of the renal tubules back into the blood capillaries that located around the tubules, that is a peritubular capillaries, and some constituents of glomerular filtrates, example glucose, amino acid, do not normally appear in the urine because they are completely reabsorbed unless blood vessels are excessive. So this is the process of selective reabsorption. Now we will see the tubular secretion. Disposing of substance not already in the filtrate, like drug, and eliminating undesirable substance that have been reabsorbed by a passive process, urea and uric acid, and ridding the body of excess potassium ions, and by secretion of hydrogen ions for controlling blood pH. This is about the tubular secretion. Now we will see the composition of urine. So the urine contain water 96%, urea 2%, uric acid, creatinine, ammonia, sodium, potassium, chloride, phosphate, and sulfates and oxalate. This is in 2%. So total 100%. This is about the urinary system. Thank you.